Hey everyone! Today, we're diving into a topic that's important for many women to understand: the difference between menstrual blood and bleeding during pregnancy. It can sometimes be confusing because they can occur around the same time, but there are key signs that differentiate them. Let's break it down. 1. Color menstrual blood typically starts off bright red and may darken over time, while implantation bleeding, which happens during early pregnancy, tends to be light pink initially, turning to brown or even black as it ends. 2. Amount of blood. During your period, you might go through quite a bit of blood that fills up pads or tampons. Implantation bleeding, however, is usually very light, a few drops or light spotting, nothing like a regular period flow. 3. Timing of bleeding implantation. Bleeding occurs around 10-14 days after fertilization. This happens when the fertilized egg attaches to the uterus lining. It can sometimes coincide with your expected period, leading to confusion. However, if you experience implantation bleeding, you might not get your regular period the following month. 4. Duration periods typically last from 2 to 7 days with consistent flow. Implantation bleeding, on the other hand, usually lasts no longer than 2-3 days and might even stop and start intermittently. 5. Texture. Menstrual blood often contains clots due to the shedding of the uterine lining. Implantation bleeding, being lighter and shorter, doesn't usually have clots. 6. Cramping. Both menstruation and implantation bleeding can cause cramps. However, cramps during implantation bleeding are usually milder and shorter in duration compared to menstrual cramps. 7. Other symptoms. Implantation bleeding is typically not accompanied by other menstrual symptoms like intense cramping, increased appetite, or mood swings. However, it can be a sign of pregnancy, which may later show symptoms such as nausea, frequent urination, breast tenderness, and cravings. Remember, understanding your menstrual cycle and paying attention to your body's signals are key. If you suspect you might be pregnant, consider taking a pregnancy test or consulting with a healthcare professional for confirmation. And there you have it. Knowing these differences can help you navigate your reproductive health more confidently. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more content like this. See you next time.